My name is Aiden Small, and this is an alternative to the current solitary confinement methods. Research continues to show that solitary confinement may not be the best option for inmates, especially those with existing mental health issues. Studies have shown an increase in self harm, suicide, psychotic disorders, physical health issues, and recidivism when an inmate is placed in solitary confinement for an extended period of time. Many argue that solitary confinement is necessary for inmates who do not follow the rules of the prison or for those who are violent. However, the outcome of solitary confinement may not be worth the punishment. Jurisdictions are inconsistent in policies and practices as there are no federal laws indicating specific restrictions for the use of solitary. The United States is in desperate need of a policy revision when it comes to the use of restrictive housing. Inmate populations have more than doubled over the past 20 years. However, we have only have an approximately 30% more prison staff than we did 20 years ago. On any given day between 2011 and 2012, 4.4% of state and federal inmates and 2.7% of jail inmates were in solitary confinement in the United States. 18.1% of prisoners spend time in solitary confinement in a year's time, and 9.5% of those inmates spend more than 30 days in solitary confinement. 30.9% of 18 to 19-year-olds spend time in solitary, as well as 2.9% of inmates suffering from serious psychological distress, and 27.8% of inmates who identify as lesbian, gay, or bisexual. A 2014 research study conducted by Ingst, Muller, Gala, and Udesen demonstrated that solitary confinement has a negative impact on the mental and physical health of inmates. They also concluded that inmates with pre-existing mental illnesses are more vulnerable to the effects of solitary confinement. This study stated that solitary confinement affects rehabilitation and the chances of successful reintegration into society after release. The solitary confinement conditions play a large role in the effect on the inmate. According to this study, social isolation, reduced activity, and loss of control over one's daily life is a toxic mix that results in the highest level of effects on health. Inmates studied in the worst conditions suffered from intestinal problems, heart palpitations, migraines, poor appetite, insomnia, depression, anger, anxiety, and self-harm. Prolonged time in solitary confinement can lead to insomnia, confusion, hallucinations, and insanity. In 2008, a study took a closer look at health effects of solitary confinement. The study confirms that solitary confinement has a profound effect on inmates with pre-existing mental health disorders. However, the severity of the impact depends on individual facts, environmental factors, regimen, and the context of isolation. Prisoners in this study found it hard to distinguish the difference between reality and their own thoughts. Many prisoners were in solitary confinement between 11 days and 10 months suffered from auditory and visual hallucinations. Prisoners were detained for 23 hours a day with little sensory or mental stimulation. Inmates who were participants suffered from heart palpitations, insomnia, back and joint pain, deterioration of eyesight, weight loss, lethargy, weakness, and aggravation of pre-existing medical problems. They also suffered from anxiety, persistent stress, irritability, panic attacks, depression, hopelessness, irritability, poor impulse control, poor concentration, confused thoughts, disorientation of time and space, and psychosis. In addition, there were reports of self-harm and suicide. In California, 69% of prison suicides happen in solitary confinement. In a 2006 study, 200 prisoners were looked at in various state and federal prisons. It was concluded that solitary confinement caused severe exacerbation of reoccurrence of pre-existing illness. In addition, inmates who had previously been free of mental illness developed acute mental illness. When evaluated by a psychiatrist, inmates showed signs of panic, fears of suffocation, and paranoid distortions. They also suffered from panic attacks and had difficulties in thinking, concentration, and memory. CABA studied medical records of inmates in the New York City jail system between 2010 and 2013. There were a total of 244,699 inmates who had entered into the New York City jail during this time. 7.3% of these inmates were admitted into solitary confinement. 53% of those inmates performed acts of self-harm, and 45% of those inmates committed potentially fatal self-harm acts. Those who harm themselves while in solitary confinement in New York City jail get transferred to a therapeutic setting. This could provide as an incentive to inmates to self-harm so they can be moved out of solitary confinement. They may believe that self-harm is worth being taken out of isolation. Self-harm is a drain on resources. The inmates who self-harm receive immediate medical and mental evaluations and are transferred to a therapeutic setting which requires 2 officers as escorts. Approximately 3,760 hours of additional time are logged by correction officers per act of self-harm. Suicide attempts are a major concern for prison systems at this time. More than half of inmates who die in prison from suicide are between the ages of 25 and 34. The most common ways of inmate suicide are through starvation, overdosing, and wrist slitting. During a 2007 study by Pseudo, it was concluded that suicide was attempted due to mental health problems, relationship issues, and prison factors. The development of social networks in prison is important for inmates, so when they are placed in solitary confinement, the ability to do this is inhibited. This gives inmates a sense of idleness and isolation, leaving them at a higher risk for committing suicide. The study showed that 2/3 of suicides in prison happen when an inmate is in solitary or in a single cell. Social isolation and lack of stimulation induce psychotic symptoms such as violence and self-harm. In addition, the design of the building can increase the risk of suicide. Lack of light, poor air circulation, too much light, and the size of the cells can leave an inmate vulnerable to psychotic symptoms. These are common issues in the design of solitary confinement cells. Inmates who are placed on suicide watch are placed into isolation and stripped of their clothing, leaving them to feel degraded and have an increase in depression. This may cause inmates to not report their feelings of self-harm, as they are afraid how they may be treated, and as a result, they will be more likely to commit suicide because they are not getting the necessary help. Pseudo found that inmates are not treated with care when they make reports of self-harm and suicidal feelings. Inmates in solitary confinement are allowed to shower 3 times a week and are allowed to exercise for 1 hour 5 times a week in a small concrete yard. When they leave their cell, they are shackled and have a pair of officers with them at all times. Lovell completed a research study that shows that prisoners have a hard time coping with solitary confinement due to existing mental issues or brain damage. They're not receiving the treatment that they need. In addition, there is no specific pathway that ends with an inmate in solitary. Some inmates may be punished with solitary while others who commit the same violation may not. There are no laws or recommendations when it comes to solitary confinement. Lovell's research study looks at the recidivism rates of those who were in solitary compared to those who were in the general population. Solitary confinement leads to a higher rate of paranoia and social anxiety, and as a result, these inmates have a harder time adjusting back to the world after being released from prison. The results of the study showed that inmates who have been in solitary confinement have higher recidivism rates than those who have not been in solitary, especially if they are kept in solitary up until the date of their release or at least 3 months beforehand. Anderson conducted a lengthy study of prisoners in solitary confinement compared to those who were not in solitary confinement. A total of 228 prisoners were studied. 133 had been in solitary and 95 had not. They ranged from 18 to 30 years in age. Participants in the study were interviewed within the first 6 days of the study, 3 weeks after that, and then every month for 9 months. They also completed questionnaires and were administered health and personality tests. In conclusion of this study, Anderson found that prison creates stress, whether the prisoner is in solitary confinement or not. However, solitary confinement creates a higher risk for developing a psychiatric disorder depending on the amount of previous confinements and the age of the inmate. Labrick and Smith looked at the long-term effects of short-term solitary confinement stays. This study concluded that there are no long-term negative effects for inmates in solitary confinement for 60 days or less. While in solitary confinement, inmates may have inhibition, anxiety, submissiveness, depression, and hostility. Once released from a short-term stay in solitary, these effects begin to subdue. In conclusion, solitary confinement is not overwhelmingly aversive, stressful, or damaging to the inmates. There are many gaps throughout the research on solitary confinement. There's inconsistent terminology and unreliable methods of data collection, making it difficult to compare data from one prison to another. In addition, prevalence data was used in most studies. This provides the population of inmates in solitary on a specific date compared to the population on a later date. However, there's no indication as to whether or not the same inmates were still in solitary confinement or if it was a new set of inmates being used in the studies. Studies also do not clarify if inmates were removed from solitary and placed back into the general population of the prison, or if they were removed because they were released from prison altogether. For many years, the United States prison system has used solitary confinement as a way to control difficult and dangerous inmates. Recently, more inmates are placed in solitary confinement as a means of protective custody. Research studies on the topic make it clear that inmates do not enjoy being in isolation. In fact, the effects of solitary confinement can cause mental and physical problems, as well as make existing problems more severe. Inmates are not the only population against this type of punishment, however. While an inmate is in solitary confinement, it is not common that they will be allowed to make calls or have visitors. This puts a strain on the families of prisoners. They are left wondering about the safety of their loved one, causing them secondary trauma. If an inmate is in solitary confinement for an extended period of time, they may miss out on family events. Inmates in the general population miss out on family events, of course, but they do have the ability to be told about the details in visits or during phone calls. Unfortunately, prisoners in solitary do not have this privilege. This can add to their feelings of loneliness and isolation. Many members of the general public are against the use of solitary confinement as well. Innumerable individuals in society view this as an unnecessary disciplinary tool, and many people believe it to be cruel and unusual punishment. Even though there are those who are severely against solitary confinement, there are just as many who are for it. It is common for people to believe that if an inmate ends up in solitary, there is a good reason for it. If a prisoner violates the rules of the prison or is violent, then they believe that placing them in isolation is the best move, not only for the safety of the inmates, but also for the safety of the prison staff. Legal personnel, prison staff, and many members of the general public forget that prisoners are still human beings. Once someone has committed a crime, they seem to think that they no longer deserve basic human rights. Solitary confinement is just another form of acceptable punishment to them. Now, there are those who are for solitary confinement and those who are against it, and then there are those who are in between. Many people believe that solitary confinement may be an acceptable form of punishment as long as it is used in short increments. The effects of long-term solitary confinement are damaging to the mental and physical health of inmates, and these people can recognize that. However, they also see that there is a need for additional punishment and protection within the prison system. Solitary confinement is tremendously expensive. These cells take up additional real estate that could be used to house additional inmates. Solitary requires a single cell per inmate. In addition, inmates in isolation are more likely to self-harm. This requires the movement of inmates to a medical unit. The cost of healthcare increases as the solitary confinement population increases. This is true even if the inmate does not self-harm, as research shows that they are more likely to suffer from mental and physical problems when in isolation for an extended period of time. Solitary confinement also requires additional guards anytime an inmate is being moved. This requires additional pay that the prison has to give employees. Although there are many studies addressing the psychological consequences of adult solitary confinement, the U.S. Supreme Court has ruled that it is not a violation of our Eighth Amendment right. The Eighth Amendment protects us from cruel and unusual punishment. However, in January 2016, President Obama did ban the use of juvenile solitary confinement due to the potential for devastating psychological consequences. This is a step in the right direction. The U.S. government has made no revisions for inmates with mental illness. However, lower courts have addressed the issue. Madrid v. Gomez ruled that solitary confinement in California for inmates with severe mental illness was cruel and unusual punishment. The United States is in desperate need of a policy revision when it comes to the use of adult solitary confinement. The United States has two practical options when it comes to solving the solitary confinement issues. The government can create new laws and regulations to limit the time in solitary confinement, or the United States can abandon the use of solitary confinement altogether. If abandoned, an alternative will need to take its place immediately. I'd like to propose policy recommendations that allow solitary confinement but limit the use of it. Studies show that long-term stays in solitary confinement can be detrimental to an inmate's mental and physical health. However, short-term stays do not seem to cause severe changes in an inmate's well-being. First, the conditions of the prison need to be changed. Exposure to constant light has been proven to be unhealthy, so there should be a lights out time within the solitary confinement unit. This will ensure that the inmates have the opportunity to receive a minimum of 8 hours of rest. In addition, inmates should have access to breathable air. Solitary confinement institutions should implement new deck systems that allow the filtration of air throughout the prison system. This will reduce the feeling of claustrophobia and the chances of obtaining an airborne illness such as a cold. It is necessary to place an inmate in the least restrictive housing possible. This is for their own, other inmates, and the staff's safety, meaning it will be necessary to remove an inmate from a low security prison and place them in a higher security prison, but solitary confinement should be a last resort. Solitary should never be used to isolate inmates with severe mental health issues, thus meaning that if an inmate has any type of psychiatric issue, an alternative to solitary confinement should be implemented. If these inmates are a problem to the general population, then they should be moved to a mental health facility that is more equipped to meet their needs. Inmates who have had mild depression, anxiety, or addictions can be placed into solitary confinement if necessary, however. In addition, an inmate deserves to know why they're being placed in solitary confinement. They need specific reasons that is plainly stated in the inmate's record. This reason needs to be supported by clear and strong evidence. Right now, there is too much discretion used when deciding to place someone in solitary. An inmate may not even be aware of the reasoning and therefore cannot change their behavior to enter back into the general population. Along with the reasoning for the use of solitary confinement, there should also be a clear plan for the inmate to leave solitary confinement and enter back into the general population. This path should be created by a team of prison staff and counselors and should be included in the inmate's record. This will give the inmate an understanding of what is expected of them and what they will need to do in order to be moved to a less restrictive housing unit. Once a plan is established, reviews need to be conducted. The inmate's counselor needs to meet with the inmate on a weekly basis. If an inmate has a history of mental health problems, it should be required that the counselor meet with the inmate at a minimum of 2 times a week. This will allow the counselor to determine if solitary confinement is still necessary. Counselors should have a list of questions that they'll ask the inmate, as well as conduct personal observations. At the end of the review, the counselor should meet with the prison staff that assisted in creating the plan for the inmate in the first place and discuss whether the inmate should stay in solitary or if they should be moved back to general population. If it is determined that solitary confinement is no longer necessary, an inmate should not be released into general population immediately. Prisons need to create a special housing unit that will assist in integrating the inmate back into the general population. Many studies show that inmates who are moved right from solitary confinement to the general population or into society have a higher recidivism rate. They have higher levels of violence and have a higher chance of ending right back up in solitary confinement. If a special housing unit serves as the bridge from solitary to the general population, it will help inmates get used to the idea of being around people again, and they will have less of a chance of having another violation. Currently, there are no specifications on how often an inmate is allowed to leave their cell while in solitary confinement. Under this recommendation, it will be necessary to come to a decision on the proper amount of time allowed out of the cell. This should be followed by all U.S. prisons. Prisoners should have the ability to take a minimum of 4 showers a week. At this time, they should be escorted by correction officers to a shower that's only used by the inmates in the solitary confinement unit. In addition, they should be given access to 1.5 hours of exercise or yard time 5 days a week. During this time, they should be taken to a secured part of the yard as weather permits. This will give them access to sunlight and fresh air. They should also be given the opportunity to attend religious services of their choice 1 day per week. If they choose not to attend a religious service, they may have a weekly visit from a religious personnel. Inmates should not be allowed visits from family or friends, however, but should be allowed to call one person once every 2 weeks. This will allow them the ability to check in with their loved ones, giving them peace of mind. This will also prevent any scandals from inmates' loved ones because they will not be left wondering about the safety of the inmate. They should also be allowed 1 visit to the library 1 day a week and select up to 2 books. Research shows that inmates need to keep their brain active in order to avoid mental health issues, and reading can assist them with this. Extensive checks should be conducted before the inmates can keep the book in the cells to ensure that there is no weapons, drugs, or illegal contraband. In addition to these changes, there should also be a disciplinary team that conducts yearly reviews of solitary confinement facilities. This should be a team appointed by the government and should include scholars, doctors, counselors, and political personnel, but should not include any prison staff. They will review the prison system and ensure that they are meeting all requirements and following all of the laws. Violations could result in penalties, removal of staff, or prison closures. It's also important that all prison staff are regularly trained. It's common for staff to be trained when hired and then never go through training again. Due to the constant changes in the criminal justice system, it's extremely important for staff to be trained on a regular basis. They need to be kept up to date on all policies and procedures. This is for their own safety and the rest of the staff's safety and the safety of the inmates. Training should be conducted every year, but if larger changes are made to policies or procedures, short training sessions should be conducted to bring staff up to date. Lastly, it's important to limit the time that an inmate is in solitary confinement. Continued research should be conducted to determine when long-term effects begin to happen to inmates. When this is decided, laws should be implemented that prevent inmates from staying in solitary confinement past this time frame. If an inmate is kept in isolation for the entirety of this time frame and the prison staff and counselors do not believe that they are fit to enter back into the general population, it should be determined if the inmate should be moved to a mental health facility or possibly a supermax prison. There will also need to be a specific time frame between solitary confinement sessions. Inmates need to be given the chance to recover from a stay in solitary before they're placed back into isolation. I'd also like to propose an alternative to solitary confinement. Many people question the fairness and constitutionality of this method. Instead of relying on placing inmates in isolation, prison systems should have a separate secure unit within the prison. If an inmate is determined to be violent or has violated the prison rules and needs additional punishment, the inmate should be removed from general population and be moved into a secure unit. They will be placed in individual cells with no roommate, but these cells will have a window to prevent feelings of isolation. While in the secured unit of the prison, the inmate should have access to a substantial out-of-time cell. They would be allowed access to yard time in a secured part of the yard. They would have the same amount of showers and free time as the rest of the inmates, but they would not be allowed to be in the general population. 2 guards should be present at all times when an inmate is out of the cell. During their times in the secured unit, they will have to attend programs to receive treatment for behavioral problems. Specialized staff will be assigned to inmates on a case-by-case basis. Counselors and therapists will help the inmate determine what the underlying issue is and create a plan to overcome this problem. The specialized staff will also create a plan to move the inmate back into the general population. Together with the inmate, they will create goals that will need to be completed before the inmate can be considered for replacement. These goals should be reviewed on a weekly basis. There should be a goal date presented for the inmate to be moved back into general population, but this will not be a mandatory date. It may be determined on that date that the inmate needs more time in the secured unit. Under this plan, there will need to be an increase in prison staff. This may require the raising of taxes, which could present a problem with the general public. However, it would decrease the amount of funds that are being used on mental health problems caused by solitary confinement. This plan would end up saving the citizens money in the long run. Inmates in secured units should have access to library materials as well. They should be given the opportunity to find a distraction to their problems. They should not have access to other forms of media, however, other than those books. They will be allowed visits from family members once a week and be allowed to make 1 phone call a night. This will prevent the family from having feelings of secondary trauma, as well as prevent the inmate from feeling isolated. Even though they cannot be around other inmates, they should not be kept from their family. Visits will not be in an open room for the safety of the visitor. Instead, the inmate will be kept behind glass until they are placed into the general population. 2 guards will be present for the visits at all times. A multidisciplinary team formed by the government will be assigned to evaluate these secure unit programs. This team will have medical personnel, members of the criminal justice system, therapists, and scholars. They should conduct yearly audits to determine that the prisons are not using solitary confinement methods. They will verify that there is no cruel and unusual punishment and will score each prison based on how they are following the policies and procedures and on their recidivism rates. Our current laws allow the prison system too much freedom when it comes to solitary confinement. Research shows that extended stays in solitary confinement can be detrimental to an inmate's well-being, especially for those with existing mental health issues. Short-term stays do not have long-term effects unless the inmate has a pre-existing mental problem. It is more important than ever to revise our current laws. Should we choose to do this by limiting the use of solitary confinement or by eliminating the use completely, a policy revision is long overdue for the United States justice system.